Let's get
Yeah.
together. Let's make this thing happen. Let's get some guests on here. Let's talk about it because people are not talking about it.
I,
And that's kind of what opened that book. I had an idea, and then I made that idea a reality, you know?
That's
yes.
awesome.
We love
So,
that.
so I had radiation. So I do want to ask, what specifically was your job?
Well, is
When,
because
what?
you're still
Right.
doing it,
Yeah.
right? You're not.
Yeah.
Yeah, you're
What
doing
specifically
everything.
did you do? Because I remember I had like radiation nurses, I think they were, and they would like take me to radiation. They would do all like the measurements and all that stuff, and they would like control the machine, whatever it was. So what exactly do you do?
And we still remember them, even though it has been over 4 years. We remember them so clearly
Yeah.
because they were incredible
I
and
love that.
touched our lives.
Yeah, they were great.
They
It's
were
that
great.
part. It's that part, Michael, right? I mean, it's you going through treatment. These people are there every day and they're taking care of you. It's a
Yeah.
relationship, right? And that's the part that I really thrive on. And so what did I do? I mean, as radiation therapists, we treat all the cancers that are possible, right? Brain, breast, lung,
Yeah.
prostate, whatever, extremities, we do it all. So there's nothing that we don't treat. So that's been my exposure uh, of radiation oncology. Now, radiation therapy as a radiation therapist, you see the doctor during your consult, and then you see him once a week, right? Just kind of see how you're doing,
Basically.
right? And then you see the nurse also once a week, or if you have a question. But you see your radiation therapist every single day
Yeah.
because these are the people that are pushing the button, that are lining you up,
Yes.
they're in a room with you. So that's us. So I
Right.
see my patients every single day for
Yeah.
X amount of weeks, where the doctors and nurses see them once a week or as needed. So with that, that's the relationship, right? That's the relationship that we're building and that we're dealing with, and that's the part I love. Yeah,
What came first, the cancer coaching or the podcast? Or were they simultaneous?
kind of both,
Okay.
kind of
Okay.
both, right? The idea came years before for the
Yeah.
podcast. Um, cancer coaching, cancer coaching came first. I took that whole deal, and then I was like, spiraled into, okay, guess what? This is an opportunity now to really open that podcast that we talked about, or open that show and create that platform and bring things together, bring people from different modalities and specialists and talk about what's going on. And I think a lot of times when you get a cold, is we have so much information, we know what to do. You may go get NyQuil or Mucinex or whatever it may be, and you do everything. Everything is for a cold is there, but when you get cancer, it's like cancer. I don't know. We don't have enough information. And now we're hitting Dr. Google. Google this and Google that. And I thought there's so many misconceptions behind that. So I decided, you know what? Let's kill the misconceptions. Let's kill all of that secrecy. Let's bring some things together. Let's get this whole community and bring it and so that patients who maybe had someone who's been diagnosed with cancer, or someone they've been diagnosed with cancer, they can have that information in their arms, right?